Hello, everyone. Welcome once again to The Doctors Are In. I am so pleased and blessed and honored to be here with you today. Remember, we are here to serve you, and we have phenomenal doctors as part of our panel this month. We have Dr. Whatcott, and we also have Dr. Balakrishnan, and she's coming in a second time. I guess she was having problems with her first connection. In any case, we have a couple of questions that were sent in to me, but we always start by asking people who are actually here with us physically if they have some questions first. So, but before I go into that, I'm going to allow Dr. Priya and Dr. Cilla to just give a 2-minute intro for themselves about who they are and perhaps what they specialize in, what they really have fun working with, and then we're going to jump into the meat of things. So who wants to jump in first? Oh, Dr. Priya, go ahead, go.
Oh, thank you, Dr. Gamble. You're the kindest. I appreciate your invitation so much. I love being here with you. I just learn so much from you. I learn from the experts you invite always. And your patients are wonderful. And it's just beautiful to see the relationship you have with them. So thank you from the bottom of my heart for inviting me and having me here. I am an internist and a nephrologist, and I have gotten into regenerative therapies and medicine in a very big way over the last several years. I have successfully reversed advanced chronic kidney disease and even end-stage renal disease. And I'm working on reversing diabetes, heart disease, and neurological diseases. In addition to that, I've gotten into the more basic sciences understanding of regeneration and how the body regenerates and how we can facilitate or reactivate regeneration. And of late, I also have taken an interest in pediatric asthma. And I'm working with parents to help prevent their children from having asthma attacks. And then non-medically, I'm interested in the profession of teaching. So I'm helping teachers get healthcare coaching certifications so that they can advance their careers.
Awesome.
And so, yeah, and there's also a research side to everything. Yeah, but thank you for the opportunity. I appreciate you so much.
Yay. And Dr. Cilla?
Yeah, well, thank you for having me here. I'm thrilled and honored to be a part of this panel, and sure I'll learn quite a bit. I'm a classical homeopath with a PhD as well in homeopathy, and my practice is in Minneapolis, Minnesota, but I work remotely with people all over the world. And one of my special interests has been homeoprophylaxis, which I've done research and application of for the last 20 years. So I've been one of the pioneers bringing it to the United States because many parents are interested in an alternative to vaccines. So there's 3 great applications for homeoprophylaxis, or HP, we call it. It's childhood diseases, tropical diseases for travel, and also pandemics and epidemics. So there are 3 excellent applications, and I've done a couple of books on the topic. I've produced and directed 3 films, which are available on Gaia.com. And part of the first film is free of charge on my website.
Wow.
What else? I've taught at a community college for a number of years, and I also have a training program for medical professionals in homeoprophylaxis, how to administer it and support and educate their clients in homeoprophylaxis.
I would be interested. Thank you.
And
that's great. Yeah. Are you in Dr. Priya, are you in India?
No, I'm in Houston, Texas. I'm sorry. I probably don't look like I'm in Houston. Yeah.
But, that's great. Yeah.
Yeah.
Well, the reason I ask is because in India, the government uses homeopaths to actually administer homeoprophylaxis, so they respect it and utilize it. So
very much. I know my whole family uses homeopathy in India. We have a huge fan following in India. Yeah.
Nice.
It's a very, very highly regarded medicine.
Yeah.
Nice. Well, I'd
So
love to
I
have you
appreciate
in the,
everything you're doing. It's wonderful to.
yeah, thank you.
Yes, I would be honored, be an honor and privilege to learn from you. Thank you.
Yay.
Appreciate that so much. Yeah, I would love to connect with you after this call. Yes, thank you.
Perfect.
Great.
Thank you.
So
Appreciate it.
remember, everyone, that all of the doctors in our panel are able to be contacted. And one of our primary goals in doing this particular event is to connect you with people that can help you and assist you after the call, because there's no point learning about something and then you just kind of put the book on the shelf. In any case, last month we talked about prophylaxis, and I saw that Dr. Cilla has all of this phenomenal teaching stuff on her website, and I saw a phenomenal video. I also love teaching children, and really and truly, all of us are kids, really and truly. So I figured that I would show you a little video that she has on her site that you can see and that you can share with other people. And it talks about giving us an overview of homeoprophylaxis.
Hi, my name is Cilla, and I'm a classical homeopath. Years ago, I became interested in something called homeoprophylaxis, and I'm going to tell you what homeoprophylaxis is, but first you should know that for short, we call it HP. HP is a way to build your immune system, or help your immune system get stronger so that germs and viruses live in harmony with your body. HP is a way of homeopathically introducing your system to the frequency of a disease. When we take the special homeopathic remedies given to us by an HP practitioner, we're able to meet the disease without getting sick from it. We actually get stronger because our immune system gets exercised by taking the homeopathic version of the virus, which is diluted to the point that it's very safe. Basically, there's nothing harmful or toxic left when we take the remedy because it's diluted to the point where we're just meeting the energy of the virus. Now, I know this is a little confusing, so I want to share a story that'll teach you how this works. Remember, homeoprophylaxis lets you meet a virus and get to know it without actually getting sick. It's kind of like when you're getting ready to go to kindergarten and your teacher sends you a letter in the summer before school starts. Maybe your teacher sends you a picture as well, so you can see what he or she looks like, and you'll know who they are when you really meet them. They tell you a little bit about themselves too, like what they like to do or what their family's like. Then when you actually meet them in person, it's kind of like you already know them because you already met. So you're not as nervous and you're not afraid. This is exactly how HP works. It's a way of meeting a disease that allows your body to get to know it gently and slowly. So if you ever get that disease, you wouldn't actually get sick because your body already knows that disease and will remember it.
So that just gives you a little overview of homeoprophylaxis. And Dr. Cilla, can you just give us, you said that you can use it for 3 different situations. Can you just tap on those for us?
Sure. So for childhood illnesses, there was a 15-year study done by Dr. Isaac Golden in Australia with about 3,000 children. And he compared children doing HP, children vaccinated, and children doing nothing. And what he found was about a 90% effectiveness rate with HP, completely safe, no injuries, no bad responses. And also he was surprised to find that these kids had more robust immunity than kids who did nothing, because he thought they would be equal. But what he conjectured was that they were receiving the diseases in a mild form energetically. So it was boosting them like Mother Nature had anticipated without any of the risks. So that's the childhood program. And it's kind of delivered over a period of 3 years. So there's these little constant reminders, and then there's boosters available and a lot of education surrounding it, because my main goal is to educate, support parents. The other application is tropical diseases for travel. And it's really fabulous because there's no cold chain required. So you can ship these all over the world. There's no needles required. So you can have non-medical personnel deliver and administer them. they're not age specific or gender specific or even species specific. So you can give the same dose to children, adults, put it in animals' water to, stop the spread of a certain disease. And also they apply to mutations. So we know that vaccines keep coming up with booster after booster after booster because viruses mutate.
Mhm.
Well, with homeopathy, it's about the symptom picture. So you don't need to change it. You can use the exact same HP as things mutate, which is really great to do. The third application is epidemics. And as we know from this last one, that there's no one right answer for epidemics. So Cuba had a combination they used. India had a specific homeopathic remedy they used as a prophylactic. I created a combination, which I then did a survey with about 500 people to see who got sick, how long were they sick, what were their symptoms, and the results looked really good. So, and historically, we know that during Spanish flu, 1918, we know during cholera outbreaks, during the polio outbreak, all of these applications were fabulous for homeoprophylaxis. So those are the three ways we apply it.
Awesome. And for those of you who were not with us last month, I encourage you to go back and look at last month's recording where we had a really wonderful presentation by Dr. Ali. And she talked about what is homeopathy and why it is so safe, how it is created. So I encourage you to go back and look at that. In any case, we're going to do a deep dive now into the questions that we had sent in. But before that, any questions from anyone here that you would like to have us address? Dr. Priya.
I have some questions, Dr. Gamble. I seek your indulgence in asking Dr. Willa some questions, if that's okay. Mm-hmm. It's just for our enlightenment and education because she knows so much. I really think it would lift us.
Absolutely, yeah.
Dr. Willa, oh, thank you. I appreciate that, ma'am. So, Dr. Willa, I was wondering if you could share with us. I have a particular interest with asthmatic children. So, a lot of them they have, childhood viral illnesses. Other friends bring them to school or whatever, and then these kids get sick. Is there something that can be given to these children that are predisposed to asthma prophylactically so they don't fall sick? And the second question is, of course, about the current pandemic, both for adults and for children, homeopathically, what is there that can be done? And also for people with this post-COVID syndrome or what is called long-haul COVID, is there any benefit to using homeopathy even in them? And then the final question is about actually something that is a personal thing that I think a lot of Americans have also suffered. It is a biological weapon created with mold toxin. And it doesn't leave the body because it's designed to take. And so is there a way that homeopathy can get rid of mold toxin, can get rid of these bio nanobots or biological weapons? If there is a way to create a homeopathic product, can I help you with that, or can I share at least my experience with you? It doesn't have to be right here, right now, but it's just a lot of stuff. And obviously, regular allopathic medicine doesn't have answers to these kinds of questions. So thank you.
Awesome. Thank you for those questions. They're all awesome. Dr. Cilla?
Yeah, that's a lot. So yes, we do have prophylaxis for the current pandemic. I have a product on my site called INF.
Okay.
People have been using that. And then for the long haul COVID, we treat it individually. So we look at the individual case. We've been using a lot of snake remedies. We've been using miasmatic remedies. So I know you know a little bit about homeopathy, and it's individualized. So we really have to look at the particular case. We also have the vaccines potentized. So we have Moderna, Pfizer, J&J, they're all potentized. And we can give those in 30C, 200C, 1M to try and clear ill effects of the vaccine.
Oh, wow.
That's-
And then,
Amazing.
yeah, as
So
far as
amazing.
mold, we do
Dr.
have
Cilla, let me just jump in and just make sure people understand the terminology. So remember, prophylaxis means preventative. So Dr. Priya was asking, is there something that we can use in order to prevent, quote unquote, COVID? And then the other thing in terms of when we were talking about 30C and all of those, remember we had in our training last month where we talked about homeopathy, where you take one drop of the element. And in this case, she was talking about the infamous shot. So you take one drop of that particular element and you combine it, or you succuss it, you shake it with 99 drops of water, let's say, or alcohol, okay? And it's shaken, and that would be 1C. And then you take one drop of that and you combine it with 99 of another alcohol, shake it, and that's 2C. And you keep on doing that till you get to 30C and 60C, 100C, and all of those things. So just to get that clarification on terminology. Dr. Cilla, go ahead.
Okay, thanks. Okay, I want to address the asthma thing because this is really, it's deep.
Yes.
It's really a product of dysregulation of the immune system. And
So I completely agree. Yes.
Yeah. And as a nephrologist, you really understand detoxification. I mean, nephrologists are some of the most respectable specialties in my estimation, because you understand how the body detoxifies. So when you have a baby,
thank you all except me, but yes, thank you, appreciate it.
When you have a baby with eczema, and you suppress that eczema with something topical, a corticosteroid, you're driving it deeper into the system. And we know with Chinese medicine, the skin and the lungs are connected. So these are the cases where we see the eczema kids, it's been suppressed, and now they have asthma.
Yes.
And this is documented. This is what we see. So the goal is to re-regulate the immune system. And we can do that with constitutional homeopathy.
Okay.
We can do that by looking at what the miasm is, or the predisposition to disease. Did they inherit something from another generation? Maybe their great grandfather had tuberculosis, or, so we address that homeopathically. And basically it's a matter of re-regulating the immune system, because when a baby goes in and gets their 2-month shots, which are 8 different vaccines, and then they're trying to detoxify, so they might come up with mucus or a cough or vomiting, and a new mother runs back to the doctor nervous about this, and they suppress it with an antibiotic or some suppressive means, and then they say, as long as you're here, let's give the next round of shots. And they load another round of shots on this baby, and now we've set up this cycle of driving things deeper and deeper, dysregulating the God-given immune system, which knows what to do.
Right.
And it shows up with chronic illnesses. And there was a statement from the it was a journal of allergy, I think in 2008, where they said, we know that asthma and allergies are a result of skewing the immune system to a Th2 emphasis, an inflammatory emphasis.
Right.
So the system's just becoming inflamed, trying to right itself. So we just, the goal is individual homeopathy to get back to that regulation of the immune system, because children are amazing. They're adaptable. They're constantly trying to move towards perfection and heal themselves.
I want to jump in where you were talking about inflammation, because that actually leads us into our first question of the night from one of our community members. The question is, I have one ankle that swells and stays that way most of the time while the other doesn't. What might be happening, and how can I naturally address it? So I'm going to ask you guys to talk about it first, and then I will jump in terms of how it's connected with what Dr. Cilla was just speaking about. Who wants to go first?
Right.
Sure. I can go if Dr.
Okay,
Cilla
go
does
for
not.
it.
I mean, okay. So there are many causes. I mean, I don't know the person's age or their gender. I'm thinking it's probably a mid-40s, mid-50s lady. It's just a guess. Could be completely wrong. But there are many causes for unilateral ankle swelling. So first I would inspect the leg. And before, of course, I would take a detailed history, how long they've had it. Is it associated with pain in any part of their ankle or foot? Do they have pain in any other joints, any swelling anywhere else, any other symptoms, skin rash or mucositis anywhere, hair loss, change in mood, lungs, heart, this the symptomatology of the different organ systems. So I would do a complete review of systems. And then I would inspect the leg to see if it is localized to just the joint or it is involving the foot and the foreleg as well, the calf and all those areas. So if it is a non-pitting edema type of a thing, and it's unilateral, then there could be some problem with the vascular drainage of that limb. So either there is venous stasis, either due to obstruction or due to regurgitation or a reflux of blood not being able to leave the limb. And that could be happening in the veins or it could be happening in the lymphatics. If it's happening in the lymphatics, it has a different set of causes, such as lymph node involvement potentially with many possible diseases, including, lymph node involving diseases, which are so many types of them. So I don't want to get into, some sort of catastrophizing here, but everything from weird diseases like filariasis to diseases like lymphoma, and all these things can involve lymph nodes and can prevent lymphatic drainage. It could also be a very benign, normal thing where as we age, we lose the muscular capacity of the blood vessels and we are not. So this is only if it's non-pitting edema of the leg, right? Now, if it is actually swelling of the ankle joint alone, right? So we have to determine if this person had sent pictures, we would know if it's just the joint or if it's going up and down as well, right? So if it is just the joint, then we would come up with some other causes. So we would first assess for tenderness, more of an orthopedic sort of an exam. Is there tenderness? Is the function of the joint intact? Are all the ligaments? That ankle joint is one of the most complex joints, with normal orthopedic surgery. But we would check if all the ligaments are intact, if all the bones are intact. If there's any tenderness, we would get some radiographic studies done, just like an X-ray. And in the other case where we were talking about non-pitting edema, we would also get some sort of ultrasound or Doppler done to check for the presence of blockages in veins or other vascular structures. So in this situation, we may get an X-ray of the ankle joint and foot to see if there's particular tender spots on the physical exam, or incontinence of the function of the ligaments, or if the tendon is torn, or there are many tests, orthopedic tests that we can do to assess if the joint is intact. Since the person has not complained of pain, it could be non-inflammatory causes of joint swelling. So things like neuropathic joint, like Charcot joint. And then that can be caused by B12 deficiency, diabetes, syphilis. There are so many other causes. It could also be just idiopathic. So be post-chemotherapy. So I think overall I would classify it as, is it foreleg, lower leg edema involving the ankle joint? And then that's mostly a vascular investigation. Or if it's an, arthritis or a non-inflammatory joint destructive problem. So if it's an arthritis, then we have to do that workup. So at least we'll look for injury and other cause of repetitive trauma. We'll also look for if there are other joints are involved, then we look for a more systemic autoimmune type thing. And then if it is non-inflammatory, then destructive causes of joint swelling, such as Charcot. So that's kind of that would be my approach. Sorry for being long-winded.
Dr. Cilla?
Yeah, so this is where a diagnosis and evaluation comes in really handy, because we have remedies that would address lymphatic congestion. We have remedies that would address vascular things. We have remedies that would address clots, and we have remedies that would address orthopedic joint problems. So knowing what it is, and I will frequently say to someone, go in, get evaluated, and then find out what your options are. You always have options, and you want to be in the driver's seat and you want to be informed. So get an eval and find out what's going on, and then we can talk about it and see what the medical doctor tells you would apply. And that puts you in a position of agency where you can decide what you want to do with more information. Does that make sense?
Yeah, I love what you're saying in terms of getting the diagnosis, because I always tell my clients, first of all, I'm not a medical doctor, so I'm not interested in the game of doing diagnoses. You go ahead, go get your diagnosis and bring it to me. And then, as you said, Dr. Cilla, then we look at it and we present people with options. Well, you can use the medication and know that these are the pros and these are the cons in dealing with those medications, or you have blah, blah options. So one of the first things that I ask people to do, especially when they have those swellings around the ankle, is number one, to take their hand and to touch it and to see if it's warm, because if it's warm, then that's giving you some kind of information about the fact that it may be an inflammatory condition, or it may be that the blood, look at it and see if there's any kind of discoloration. Is it a matter of the blood pooling in that area? Because for a lot of people who may have varicose veins or things of that nature, where the valves are not working as efficiently as they should be, then the blood kind of pools down there. And so some of it may be you need to get off your feet. Maybe you are just standing up too long during the day. And because you're older and because the vasculature is not as strong as when you were younger, the blood kind of pools there. So, asking that question about what time of day are you observing this? Is it later on in the day or is it in the morning? That gives you some clues also. Is it, as you said, if it was tender, as you said, Dr. Priya? And one of the things that we look at, if there's that inflammatory condition where there's inflammation in the body, for us not to say, oh my God, inflammation, the horrible, horrible thing, but to ask ourselves, well, what's the purpose of inflammation? The body is not stupid. God designed this body so ingeniously that every single thing that we designate as a symptom is actually a blessed message. I think, Dr. Cilla, one of the things that I find so troubling in all of the years that have occurred is the fact that we have totally lost an appreciation for the power and the wisdom of the body. So when they created this concoction that they call the C shot, their whole thing is it's going to minimize symptoms. And to me, Dr. Cilla, Dr. Priya, that was the scariest thing I heard from the whole thing. Oh my God, you're going to minimize symptoms. That's like saying, you know what? I'm going to get rid of all the messengers. I'm going to take all of the smoke detectors out of your house. So you have no clue about what's happening.
Yes.
And so when we look at inflammation, instead of getting upset at the inflammation, if it's gone to a certain extreme, we definitely want to bring it back into balance, take it off of the ledge, so to speak. But really and truly, we have to get down to the root. Say, why is there inflammation there? And most of the times when we have inflammation, it is because the body is seeking to heal that particular part of itself. It's seeking to break down waste matter. It's seeking to bring blood to a certain issue so that you can repair efficiently. And so that is what we have to look at. So I love what you guys have contributed for this particular question. And we're going to move on to the second question we have here.
Dr. Gamble, thank you. Dr. Gamble, I just want to say thank you so much for sharing your insights. They were invaluable. And Dr. Cilla, just wonderful answer as well. Thank you, ma'am. I appreciate both of you. And I just want to ask one question that we can all take turns answering also. How would you address this once we have a diagnosis? how would you address it? If it is edema and unilateral limb due to vascular insufficiency, like venous, like varicose veins, for example, how would you address it? If it is a joint inflammation, how might you address it? So just,
Okay,
I
so
guess,
you
like
said
if you could.
you said the three particular quote unquote
Yeah,
diagnoses.
or I can, yeah,
What
I
were the
can go
three? So you
first
had,
as well if you would like me to. Yeah.
yeah, go ahead. So
Just how we would address it. If it
those
was
three.
vascular insufficiency, right? So that history that you brought out, Dr. Gamble, which is it more swollen at the end of the day when you've been on your feet all day? That's a beautiful example of how you can distinguish and just from history, get very close and make the diagnosis even. So if they have that problem, right, then you want to strengthen the muscles of the calf muscles and the ankle muscles, and the muscles that go around the ankle joint and all of that, so that the veins grow in caliber and the wall of the veins the muscles and the walls of the veins become thick enough to push the blood back. Now it's so you want general body reconditioning. You want to be doing general muscle building all over the body in order to minimize or reduce venous varicose veins type problems. Now, if there are leaking vein valves, you may need to have a vascular surgery opinion on that to if it's that much of a trouble. Now, if it ends up being inflammation, like an arthritic problem, either osteoarthritis or some sort of orthopedic injury, then I would definitely advise going to an orthopedic surgeon, having it further evaluated. If it is an inflammation that's systemic, like an autoimmune disease, then see a rheumatologist to get that treated. And I mean, we can go over those options too, but these are the decision points. And then if it's a neuropathy, which is non-inflammatory joint involvement, there are some causes of that as well. And so we need to get to the root cause of that, where it can be identified and treat that. So that's basically all that I wanted to say.
Dr. Cilla?
So the general belief in homeopathy is that the vital force can heal anything. So, I mean, seeing specialists, getting an evaluation, it's helpful, it's valuable, but I've seen amazing things with homeopathy, and we need to understand what we call modalities. Modalities are what makes it better, what makes it worse. If you put a cold compress on it, does it feel better? Or are you seeking warmth with it? Do you take a hot bath and that makes it feel better? So it comes down to minute individualization of the case. I can have 10 people with the same apparent symptom. They're going to get 10 different remedies. So we need to understand everything about that case. And then, I have such faith in the vital force, and I've seen amazing things. We had a client with severe inflammation, and I forget the drug that he was using to reduce inflammation, but he weaned off the drug. We gave him Apis mellifica, which is bee venom, homeopathic bee venom. All the inflammation's down. We had to use a very, very high potency, and he takes it regularly, but the inflammation is down. Someone else that has DVTs, deep vein thrombosis in the leg, and we give arnica, which breaks up blood clots. But again, it has to be individualized. You can't just say everybody should use that particular remedy for something, because then we're moving homeopathy into allopathic application.
Yeah.
And it loses something.
I love what both of you are bringing out to the table. And as you were saying, Dr. Cilla and Dr. Priya, I look at what's happening in the background. So, for instance, number one, let's talk about why are you on your feet so much? Is there a situation where you can maybe put your feet up? If you're a cashier or a nurse or something like that, can you put your feet up? So a lot of times you'll see there may be like a little step stool that you can put your feet on to like change the gravitational pull. And then when you get home at night, put your legs up. I've had clients where they won't do anything else. They won't change their diet. They won't do whatever. but at the very minimum, they'll lay down and elevate the legs so that the blood will come back down. So that, those are just some of the mechanical things. And then if we're looking
Absolutely.
at the thickening of the blood, that may be contributing to the pooling of the blood, and also contributing, one of the things that we didn't really touch on is the stress on the kidneys. A lot of times when you have a situation where the kidneys are weakening, where the filtration capacity of the kidneys are weakening, then we will have an over stressing of the kidney system. And one of the symptomology that may be associated with that is edema, is the swelling in the ankles, the legs, everything else. And so we want to look at ways of supporting the kidney, nourishing the kidney with various herbs, such as parsley and things of that nature. And at the same time, thinning the blood with what we call proteolytic enzymes. And some of the proteolytic enzymes that you can use are things like nattokinase, that helps to go in and do Pac-Man and gobble, gobble, gobble all the crud that's in the blood and break it down. But really, you have to do a deeper dive into what are you eating? What are you doing with your life that's actually causing that thickening of the blood in the first place? It could be something where it's going back to diabetes, as Dr. Priya had alluded to earlier, where you have a lot of glucose in the blood. And so that causes what's called glycation, or the almost like caramelization of the blood cells and thickening of the blood. So doing things like that. Now, if you're talking about the vasculature and the valves that are perhaps weakening, and so they're not closing, so to prevent the blood from, staying in the legs and going back into the legs and pooling in the legs, you can use things like beet greens, to start to strengthen the vasculature of the legs. So lots of different things to go into. And one of the things that you guys touched on, which leads us into our next question, is I've been diagnosed with a couple types of arthritis. Right now, I'm in a lot of pain. Are there foods that I might have eaten that could have aggravated my condition? And what can I do to ease my pain?
So I think Dr. Gamble, you should address this first. Aren't you the expert in this? If you want to that,
we can all contribute. We can all contribute.
We can add. Okay, no problem.
Dr. Cilla,
Sure.
are there certain things that we can use homeopathically for different types of arthritis?
Yeah, again, I'm sorry to keep coming back to it, but it's individualized. So you got to see the whole case. You got to see where the person is emotionally, physically, mentally, what their relationship is to the disease. The way you talk, Dr. Gamble, about what are you doing during the day? All of these things play such an important role. When did it start? We call it never well since. An emotional shock, an emotional event can be the genesis of some of these chronic diseases, which we have to look at. And then there can be obstacles to cure. Like, are you drinking every day? That could be an obstacle to cure. Or did you just get a whole slew of shots? That can be an obstacle to cure. So we need to look at all that. Diet, nutrition is not my specialty. That's not where my training is. But I glean things from certain clients all the time. And I know that the nightshades, potatoes, tomatoes, peppers, eggplant, the foods that are in the deadly nightshades can be really aggravating to arthritic conditions. So that's the best I can offer in terms of food, but you probably know much more about diet and how that applies.
Well, I'm going to jump in, and I'm going to pull a lifeline from someone else in our community here. And she's smiling because she knows who I'm talking about. So you have different types of arthritis. You have osteoarthritis, you have rheumatoid arthritis, so all kinds of various variations on the theme. And itis, for those of you who aren't familiar, it's just inflammation, so let's just get that particular term out there. But we have a wonderful, wonderful person, Miss Karen Osborne. I'm going to put you in the hot seat because she likes to pretend like she doesn't know anything. She's just one of those innocent bystanders. I just come in and chill with you guys. But this lady is a phenomenal expert when it comes to anything with bone health. So Karen, can you tell us a little bit about how you would address the, say, osteoarthritis kind of issue?
Yeah, so you want to eat an anti-inflammatory diet. Eat, probably be off of the grains and off of the sugar. You want to eat an alkaline diet, like eat mostly 75 or 80% from the alkaline side of that chart. Because like if your blood is going to keep that 7.35, 7.4 pH no matter what, and it's going to pull the alkalizing minerals from your bones if it gets too acidic. So yeah, I'm just like things like lots of greens and ginger and just can't put me on spot. I can't think right now.
Oh, no worries.
Would you want me to jump in a little bit?
So one of the
What?
Shall I jump in a little bit? I'll give Karen a chance to collect her thoughts, and I'm actually going to repeat essentially what she and Dr. Cilla said. So I agree with both of you about the diet. So avoid the deadly nightshades, definitely lots of green leafy vegetables. What I'm going to share with you is how to consume the green leafy vegetables. So better to blend it, but if you're not, even better than blending it is juicing it. So I have been doing some juicing over the last 2 to 3 weeks or so for a family member who was recently diagnosed as diabetic, which was very shocking because they're very young and so on. And the green juice is one of the most potent anti-inflammatory diet options that we have. So I would recommend a juicer with the brand name Nema, N-A-M-A. It's Korean. I don't get any money from them. So I'm just telling you what I've studied and learned about this. And then I would recommend juicing a lot of green leafy vegetables. So everything from spinach to celery, to even cucumbers, parsley, cilantro. Each one has its, detox function. Each one has a potent detox function. And then I would also add carrots and apples to flavor it, to give it a little bit of, taste. I was recently reading Dr. Norman Walker's book on juicing for health. And all of his juice prescriptions, I think he has 93 of them or something. There's a lot of them. And all of there's one juice recipe that's common to all the ailments in that juice book that he's recommended. And that is carrot spinach combination. So, and I have studied with Gerson diet therapy for curing cancer and other inflammatory diseases. They use green juices a lot. They take it as a shot, 4 to 6 ounces or more, maybe even 8 every hour, 13 shots a day to cure cancer if such a thing is it still works. So back then it did. Now it is it is effective in. Yeah, I absolutely can. It's Dr. Norman Walker's Juicing for Health. He's written about 9 different books. He's the creator of the Walker juicer, which I also owned. It's a very expensive piece of equipment, complicated, hard to use, and I never really used it. But this other machine, the Nema juicer, it's not expensive. It is very easy to use, assemble, disassemble, and it really it pulverizes. It shreds the plant cell, and it takes out the enzymes and takes out the minerals. And it also takes out the structured water from these cells. It's not just the minerals, okay? Because if you just replace the minerals, yes, the arthritis may get better. But if you actually do it with juice, there is an exponential benefit to doing it with green juice. And believe me, I've tried it both ways. And I've tried it in multiple inflammatory diseases. Green juicing My sister, well, oh shoot, I told you who it was. Never mind. I'm sorry. I will just erase that if you will. She lost 6 pounds with 1 week of juicing, and her blood sugars plummeted. I know this is the cure. This is how I'm going to get her out. And I know that this will work for any source of inflammation. Now, the arthritis, like you said, it could be osteoarthritis and rheumatoid arthritis, or it could be osteoarthritis and gout. Now, gout, there's a very specific set of dietary guidelines. So always hydrate. So when you hydrate, you take, let's say a liter of water, you add a pinch of pink Himalayan salt to it, 1 squeeze of lemon, and as soon as you wake up, you drink half the liter, and then you try to drink at least 2 liters a day. Hydration is has a huge positive impact on inflammation of any cause. And then for gout, you also completely move away from inflammatory foods like dead foods like meats and any source of uric acid. So uric acid accumulation is a big part of the causation of gout. So, and then you can take medicines for these things, but they're asking specifically about food. So I would avoid those foods that contribute to the buildup of uric acid, no matter what the two arthritis are. Okay, and then and alkalinize, like Karen said as well. So green leafy vegetables, just alkaline sources of food. Don't take anything acidic. And acidic is, generally speaking, the meats and the dead foods. So I think, yeah, sorry, that was basically what
I just want to comment that I juice every day, and I have had 3 juicers, and the Nema is the best. It is
I
the
love
best.
it.
It's easy to clean. It's efficient. You can throw everything in it at once. I absolutely love it. So yeah,
That's
I second
really
that.
awesome.
So what's that?
That's awesome. Which Nema?
Is
Which
it
one do you have? The
NA?
J2 or the
Is it NAMA?
NAMA?
Say it again.
Yes.
Like mama, but with an N, Nama.
Okay, I've
Nama. Nama.
Yeah.
Actually, the Nama is the correct pronunciation, but anyway, I've heard the American people.
So now, one of the things that I always suggest to people is that, first and foremost, I don't get into diet dogmas and food religions, because the reality is that practically every food can be villainized at some point in time. Whether or not we talk about the nightshades, or we talk about the oxalates, or we talk about the purines, or we talk about whatever it is. The key is that there are no absolutes, okay? There's some phenomenal health benefits to eating different foods that we would categorize as nightshades. So there are things like mushrooms that have tremendous medicinal powers. When we look at bell peppers, phenomenal with regards to flavonoids. But the question is, what is ideal for you? And the only way to know that, or should I say one of the best ways to learn that, is through what I call an elimination diet, And what I suggest to people is to eliminate categories of foods. Well, first of all, start with your most common allergens. Sugar, well, that's a no-brainer, right? But there's still some people that need convincing that sugar is actually a food. So eliminate sugar, right? Then you have things like soy, corn, eggs, milk, or should I say dairy, grains, and things of that nature. So those are your common allergens. And when we do an elimination protocol, I say in the first round, and for an elimination protocol, you have to do it for at least 21 days. So you eliminate those common allergens in your first round, eliminate those. And then after 21 days, and 21 days, because it takes that long for your body to clear it out of your immune system, and for your immune system to calm itself down, and for it to say, oh, okay, it's all right. Yeah, we're safe now. And then after the 21 days, you reintroduce one food at a time. So let's say you reintroduce the dairy, because you just love your meat. You love your milk, you love your ice cream, all that stuff. You're like, oh no, Michelle, it can't be the milk that's doing this to me. No, no, no. So, okay, reintroduce the milk for 2 days and have all the milk you want to have. Have the ice cream, have the chocolate milk, this milk, whatever it is, fricassee it for all I care. And ask yourself, how do I feel in these 2 days? Now, there's some people that have absolutely no reaction and they are A-okay. And then there are other people who have issues, you know, like me. I'm genetically predisposed, especially as an African-American. I don't produce lactase. And so I don't have the ability to break that down. Some people will respond to the casein in the milk, 50 million different things. And then there's some people, especially certain genetic groups, that they do well with milk, have no problem with milk, you know? So if milk is okay and you didn't get a reaction, then you can move to the next food group, eggs. You know, so you start to eat 5 eggs, 6 eggs, 10 eggs, I don't care how many eggs, and see if your body reacts to it. If those aches and pains and, you know, all that stuff comes back, you know, eggs is an issue for you. If it hasn't reacted, you move to the next group. Maybe you want to move to oxalates. A lot of times people have arthritic conditions because their bodies aren't able to properly process and release the oxalates from their food and get it out of their body efficiently because of genetic reasons, right? So if that's an issue for you, you may find things like the wonderful world of spinach does not agree with you. You know, so as you reintroduce things like spinach, your body's like, oh, heck to the no, because those oxalates are like little pieces of glass that are just scraping on the inside of your joints. But for other people, spinach is the best thing that you can have because it has all of those wonderful attributes. So the key here, ladies and gents, especially when we're talking about arthritic conditions and even osteoarthritis and all of those different itises, and if you're going into autoimmune, if you're going into quote unquote food sensitivities, food allergies, food intolerances, whatever it is, the key is to begin with the simple process of an elimination protocol and slow reintroduction to test, not guess, what it is that is a particular issue for you, because you are individually created, and even you today is different from you 10 years ago. Maybe 10 years ago, you didn't have a particular reaction to the oxalates, or you didn't have a particular reaction to the nightshades or whatever it is. But now you're 10 years older and your liver isn't as optimal as it used to be. Your kidneys aren't as optimal as it used to be. Your immune system isn't as regulated as it used to be. And so now you become reactive to XYZ food. But you will never know until you give your body a break, a vacation from continuously being assaulted by these probable irritants. So, well, we didn't go ahead, Dr. Priya.
I'm sorry, Dr. Gamble, I was wondering if we could comment on what are safe foods for them to consume, even when they're going through the dietary, you know, with what do you call it, withdrawal or whatever, you know, removing the irritant ones, the allergenic ones.
Well, what I will do is ask people to get in touch with one of us to do a deeper dive, because really and truly, it is something that requires guidance. You know, elimination diets,
absolutely, I agree with that.
As you know, they can be rough. I'm just going to be straight honest with you guys. And we had one last question about, I need to get dental work done, but have been told by my dentist in the past that if my blood pressure reading is too high, he can't do the work. I don't take blood pressure medication. I try to eat right and exercise and experience white coat syndrome whenever I go to the doctor. Is there anything that I can do to calm myself down so that my blood pressure won't be elevated? Dr. Cilla, you said you had something particular, and then we'll go to Dr. Priya.
Yeah, please go.
Yeah, I mean, there's lots of easy over-the-counter, low-potency homeopathic remedies to calm you down before a doctor visit. You can take aconite, 1 dose of aconite 30C. You can take a combination called Rescue Remedy. It's drops, and Rescue Remedy can calm the anxiety a little bit. I mean, those are the two that I would recommend. Also coffea, which is coffee. So if your anxiety is typified by elevated heart rate, sweating, nervousness, as if you drank 10 cups of coffee, then coffea might be helpful. So those are definitely something you can try to calm yourself down, because if your elevated blood pressure is a result of nervousness of going in to the dentist, those can help. But if it's other pathology that's causing your elevated blood pressure, I'm not sure if that's going to help. But Dr. Priya, do you have something to add?
I do. I really appreciate the opportunity to address this question because it's right up my alley. The one thing I would say is we have to make sure that this person does not have a diagnosis of hypertension. So we have to either confirm or deny the diagnosis of hypertension. So if their resting blood pressure has never been above 160/100 or associated with end organ damage associated with high blood pressure. So let's say they did.
Yes, she confirms that she does not take blood pressure medication.
One blood pressure reading in the dentist's office.
Yeah, she says she does not have hypertension.
So that is all I'm trying to say is that we have to make medically sure that she does not have hypertension. So if she has had elevated blood pressure in the doctor's office 2 out of 3 visits, let's say, that doesn't exclude the diagnosis of hypertension. So we have to, there is a rigorous and a systematic approach to the diagnosis of hypertension. That's basically what I'm trying to say is that, so if she doesn't have end organ damage due to hypertension, and if the readings were not above 160/100, and they are not repeatedly above 160/100, then there is something called home blood pressure monitoring. So she checks her blood pressure with an instrument that her doctor agrees that she can use twice a day for 7 days. We leave out the readings of the first day, and we take the average of the remaining 12 readings for the systolic and the diastolic. And if that is not above 130 on the systolic and not above 80 on the diastolic, then she genuinely does not have hypertension. I mean, at that point, we still have to do, but let's say she's borderline. Let's say she's 130 on the average for the systolic. At that point, you do something called ambulatory blood pressure monitoring, where they wear a blood pressure cuff 24 hours a day, and it goes off every 30 minutes or so. And then you will have the doctor look at the readings of that. And then if she's above 130/80 on average, then she has a diagnosis of hypertension. So only when we've excluded the diagnosis of hypertension, then we can treat it as if it's white coat hypertension. That is a diagnosis of exclusion.
So I love
and for white coat hypertension, I've actually, sorry?
No, so I love the fact that you're so very precise in making sure that, because a lot of people are self-diagnosing, right? And they're like, oh, it's white coat syndrome. I don't have high blood pressure. I'm okay. And it's important to make sure that we aren't just throwing it off the table without really checking to make sure, because that, ladies and gents, is a killer, you know? And so I really appreciate what Dr. Priya is emphasizing here. Do not just assume that you are okay and it's just white coat syndrome. Really get that checked. And one of the things I emphasize is people being empowered, like Dr. Priya said. Get yourself a blood pressure cuff. You know, they have become so inexpensive these days that we don't have any excuses. I'm sorry, you ain't got no excuse not to get a blood pressure machine, okay? And put it at your bedside and check your blood pressure in the morning and check your blood pressure later on in the day. And as Dr. Priya said, do it for a series of several days, and then take the average of the top number, which is the systolic, and then take the average of the bottom number, which is the diastolic, and make sure that their top number is not, in terms of the average, is not over 130, and the bottom number is not over 80. So now, if you have gone through all of that, and you know for sure that you are not hypertensive, then we'll go to that question about the white coat syndrome. I love this because one of the things you can do is essential oils. I just love essential oils. And so you can utilize essential oils such as lavender, such as chamomile, and things of that nature, to just breathe in deeply. And one of the key things with white coat syndrome, well, a lot of different things. You can go into a deep kind of analysis in terms of what is your relationship with your doctor, what is your relationship with the medical profession in general, and deal with some trauma. There is some trauma associated with that can be identified and released. And at the same time, to recognize that you need to train your body to be able to shift from what's called your sympathetic nervous system, your fight or flight, into your parasympathetic. And one of the best ways to do that is through breath work. And a breath sequence, which is breathing in for 4 counts and breathing out for 6 counts, to make sure that your exhalation breath is longer than your inhalation breath. And to train yourself to do that. So don't wait until you're going into the doctor's office and then to say, oh, Michelle said I should do my breathing. Okay, breathe in 4 counts, breathe. No. You've got to train yourself long before you go to the doctor's office. This is just like training for the Olympics, training for that marathon, and train your system to be able to make that shift. And visualize yourself going into the doctor, feeling calm, feeling confident, feeling okay, and breathing through it, breathing in the lavender. And then when you get to the doctor's office, use that lavender oil as a trigger to remind your system, to remind your spirit, I am cool, calm, collected, and courageous. There is nothing for me to be concerned about. So now with that, ladies and gents, I want to thank you for being a part of our village this month. I love your questions. We love your questions. We love you. We are here to serve you. We encourage you to send us more of your questions. Give us more of your insights. I'm going to include in the recording email that goes out, I'm going to include Dr. Cilla's little video, because that was cute. Wasn't that cute? I love that video on homeoprophylaxis. And she has so much more information. She has training courses so that you can learn this for yourself and be empowered. And also you'll have the information for Dr. Priya. Dr. Priya also does educational workshops. And of course, you already know that I do educational stuff. So that's a given. In any case, we love you. We bless you.
We love you, Dr.
Gamble. We appreciate you. And we will see you next month on the 3rd Thursday.
Thank you.
Thank you
so much.